Joining me now is Dr. Ashish Jha, the Dean of Brown University School of Public Health. Dr. Jha, it's very good to see you today. Thanks for being with us. We
Thank you, Andrea.
just heard from those frontline healthcare workers. Dr. Michael Osterholm said that the next 6 to 12 weeks will be the darkest in the pandemic. What do you see as the impact going forward on the healthcare community?
Yeah, so first of all, Dr. Osterholm is one of the best in the world. And of course, all of us hope that his assessment is a little too negative, but I'm worried that he may be right. The problem on the healthcare community is in March and April, when nurses and doctors were doing this extraordinary work and through the whole pandemic, the public has been behind them. But recently, we have so politicized this that increasingly you're seeing a loss of that trust for doctors and nurses, people who are arguing that this is all overblown, that it's a hoax. And I think that is also tearing away at the sort of steadiness of the doctors and nurses who are doing incredible work. So we really need to back them on an ongoing basis, whatever our own personal political beliefs.
And speaking of the politics of all this, you have the president really going after Dr. Fauci now, saying don't believe the scientists, that they're idiots, going after Fauci personally, accusing him of being political, which he is not and is not registered in either party. Dr. Fauci said yesterday that there can't be conflicting messages about vaccines coming from the government, so people won't have faith in the safety of vaccines. Is this a concern with the administration firing shots at the medical community?
You know, it is a concern. First of all, in the middle of a pandemic, if you are going to war with the scientists and the doctors, that is a problem, because that's the community that's going to bail us out. That's the community that has developed the therapies that the president got. They didn't come out of nowhere. The scientific community developed them. So I think the president should be more positive and more constructively engaged with physicians and scientists. And this is going to really play out in a big way, Andrea, because if we start getting into these kinds of political battles with the vaccine, it is going to further diminish people's confidence in the vaccine and will make it much, much harder to end the pandemic. So we really have to let the science do its thing and the political leaders to back the scientific progress.
And I want to ask you about what's happening in the UK with these challenge trials, because to a layman such as myself, it sounds, first of all, that it doesn't give the testing the kind of diversity of volunteers that you would want, because they're testing a particular group, they're younger, they're healthier, they don't include people of color necessarily. It doesn't have the variety that you're trying to create to have a real test of a population.
Yeah, you know, these challenge trials are tricky, right? And obviously there are ethical issues about, you know, is it ethical to infect people? I do think there is a way to do this ethically with really strong consent and lots of support. But my bigger problem here is it's wholly unnecessary. You only want to do these when you have a situation where the virus is not circulating in the community and it's going to be very hard to run a regular trial. That's not the case here. So I completely agree with you that we won't know through the challenge trials whether elderly people, whether kids, whether people with chronic disease are going to benefit, right? Because we're only going to test it in young, healthy people. But I also just don't think it's necessary. So I'm not really sure why the UK is doing this right now. I don't know that I would be supportive of moving forward with that.
And meanwhile, we've got the infections increasing rapidly across the country. Just is there any way to get ahead of this at this point, or does it take national leadership?
Well, national leadership would certainly be helpful, but given that we're unlikely to get anything new there, I think we need states to really step up. You know, there are some states that have done a terrific job of stepping up. California, I've been talking about in the last few days, really out there. Their case numbers are actually declining where everybody else is going up. The problem here is that I think we've gotten lulled into a sense of pandemic fatigue. And if we wait several more weeks when the infections get really out of control, it'll be much, much harder to bring this infection under control. So I'm imploring mayors and governors to act aggressively now and not wait any further.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.